Good afternoon, Harris Hilton. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Mihiraa, hello. I'm Harris Hilton, one of the senior nurses caring for Calvin. I've just come from the team's assessment. I can see this is incredibly overwhelming. Before we go into anything, I just want to sit with you for a moment. How are you holding up right now?
I'm terrified. I've barely been able to hold him, and now he's so sleepy and cold when I touch him. He won't feed at all. Is this my fault? What's happening to my baby?
I hear how terrified you are, and that's completely understandable. Please know that nothing you did caused this. You did exactly the right thing by bringing him in. My role right now is to explain to you exactly what we think is happening, why we think that, and what we're going to do about it, starting immediately. We will go through it all step by step, and I am here to answer every single question you have. First, based on Calvin's symptoms and our urgent assessment, the medical team's clinical opinion is that he is showing signs of neonatal sepsis. I want to explain what that means. Neonatal sepsis is a serious bloodstream infection that can happen in newborns. It's the body's extreme, overwhelming response to an infection. It requires rapid medical intervention. Because a newborn's immune system is so immature, they can't fight off bacteria the way an older child or adult can, which is why we act so quickly.
A bloodstream infection? How did he get that? Is it because he was born early? I don't understand.
I understand how confusing and frightening this must feel. The reasons our team has this clinical opinion are the specific signs Calvin is showing us. Newborns with sepsis often can't maintain their own temperature, which is why he feels cold. The poor sucking reflex and refusal to feed, along with this deep lethargy instead of being alert, are his body's ways of telling us he's fighting something very serious. Mihiraa, these are not subtle signs. They are clear red flags that demand our immediate attention. As for how this happens, it's often a combination of factors. A newborn's immune system is incredibly immature and can't yet contain an infection. Sometimes there's an exposure to bacteria during the birthing process or afterward, which is no one's fault. For many babies, especially those needing NICU care, this environment, while life-saving, also carries this risk simply because they are so vulnerable. Our focus now is not on blame, but on using this understanding to treat him effectively.
So what happens now? What are you going to do for him?
What happens now is that we move swiftly and with clear purpose. The immediate action is Calvin's formal admission to the NICU, where he will receive constant, specialized care. Mihiraa, we are starting 2 key treatments right away: intravenous antibiotics to directly attack the infection, and 4 fluids to ensure he stays perfectly hydrated since he cannot feed. For you to know what to expect, he will be connected to monitors that track his heart and breathing continuously, and we will check his vital signs very frequently. To pinpoint the exact bacterial source so we can tailor his treatment, we will need to perform some tests, including blood cultures and potentially a lumbar puncture, which is a test of the spinal fluid.
A lumbar puncture? That sounds so scary. And all these wires and machines. I just feel so helpless.
It is completely normal to feel terrified and overwhelmed by all of this. Seeing your baby surrounded by technology is incredibly daunting, and your feeling of helplessness is a natural response. Please hold on to this. Calvin is now in the exact right place to receive the critical help he needs. The importance of this early detection cannot be overstated. It allows us to intervene decisively. He is under 24/7 specialist care. Our entire team is focused on his recovery. To help me support you through this, could you tell me if any specific worries or questions are most pressing on your mind right now?
I'm worried the antibiotics won't work, or that he'll have pain from all the procedures. And will he be my same healthy baby after this?
Those are such understandable and important worries. Let me address them directly. Mihiraa, the antibiotics we use are chosen specifically for newborns and are very effective at targeting and killing the harmful bacteria in his bloodstream. By doing this, they directly reduce the severe systemic inflammation that is making him so lethargic and unwell. Regarding pain, we are exceptionally careful. We use gentle techniques and provide comfort measures to ensure he experiences minimal distress during any procedure. For his recovery, we expect to see a gradual return of his energy and appetite over the coming days. His deep sleep right now is actually protective. It's his body conserving vital energy for healing. Our team will monitor his long-term health closely, but our goal with such prompt, aggressive treatment is for him to recover fully and be your same healthy baby.
So how long will he be here for? If it's what he needs.
Based on the typical course for neonatal sepsis Mihiraa, we anticipate the duration of his full-4 antibiotic treatment to be between 7 and 14 days here in the NICU. However, this isn't a fixed timeline. It truly depends on two key things: the results from his blood cultures, which tell us the exact bacteria we're fighting, and most importantly, his own clinical response, how quickly we see him improve day by day. We will adjust as we go. To begin this entire treatment plan for Calvin, do I have your full consent for his continued hospitalization and for us to commence this course of antibiotics, fluids, and monitoring?
Yes, of course. Please do whatever he needs. Just help him.
You have my word that we will. We are all focused on Calvin. I will be here closely, and I'll update you constantly.